My Doctor, your health anytime, anywhere. Hello, lovely people. Welcome to the My Doctor podcast. My name is Mwesigwa and I'm your host. And for those who are new around here, on this podcast, we majorly talk about health, all aspects of health, mental health, gynecology, pediatrics, dentistry, all aspects of health, yeah? And those who watched the episode last week, we have been talking about love, I could say, because we're in the month of love. So last week we had an episode on the science of falling in love. And so this week we're going to continue, and we're going to have an episode on tests to do before entanglement. Yeah, before entanglement, before you think of having children, before you think of becoming intimate with your partner, what tests should you do before marriage? What tests are important for the health, for your own health, for the health of your child, for the health of the entire family, of your partner? This week, we are still with Dr. Xavier, from last week, and we're going to be diving into that topic. So, hello, Dr. Xavier.
Hi, Joy, and hi, everyone. How are you doing? It's been a while.
Nice having you again. Yeah, so could you please introduce yourself again to people who may be watching you for the first time?
My name is Dr. Xavier Ayesiga, a medical doctor and a therapist, but also a social medicine advocate. I'm excited to be here in this month of love to talk about the things that make your love easy and make your marriage and entanglement better. So, yeah, I'm here to empower you.
Okay, thank you so much, Dr. Xavier. So our topic today, dear viewers, is tests to do before entanglement. What tests are important? What tests will ensure that your health is okay, the health of your partner is okay, the health of your children is okay, right? So we're going to dive in. But before we do the tests, I would want Dr. Xavier to tell us, why are these tests important? Because someone could be wondering, can I skip the tests? Are they that important? Should I have them? So before we start, why are they very important why is it very important for partners to do certain tests before they go into marriage?
Because this is going to be one of the most important phases of your life. It's important that you approach it when you're ready for anything. But also, these tests give you a sign into the compatibility that you have. But most importantly, it's sort of insurance. It's like a relationship insurance, not just for the couple, but also for the future family that you want to have. Yeah. And these medical tests importantly help you to identify the potential health risks the person has, ensure that your genetics are compatible, because disease has a very big genetic component. Yeah. And also, you plan for a future that is happier and full of love. It's not unromantic to want to do them. It's so much about being informed. Yeah. And knowing your partner's health status creates transparency. Yeah. And also helps you avoid complications. Yeah. So it's so much an act of love. Before you do the kuchara, you first kuchala to the doctor and find out how the relationship is going to work out well.
Okay, please first kuchala to the doctor. So what are some of these tests that we must do before we get married?
There are actually several categories of tests that you have to do. People tend to only do the HIV test. It's not the only thing that you have to test for. There are very many things that you have to find out about this person's body. As we had discussed last week, your brain is actually the most important sexual organ in the relationship that you carry. So you have to know also a sneak peek into their attitude. We don't have physical tests for that, but we have tests that help you see the whole picture of their body. So I'll start with, I will actually address them one by one and show you why each is important. Because some other people say, we don't have all the time. I only get to see him on a Friday, Yeah, but genetic screening is the first one, and it's so important. And what it is for, it is to identify whether you and your partner are carriers of genetic conditions. The one that is so pressing for us in Uganda is sickle cell. Mm-hmm. So basically, if you're a sickle cell carrier and you marry another sickle cell carrier, there is half chance that one of your children will be a sickler. Now, life of a sickler is hard, and I also pay respect to all those people who go through life with sickle cell disease and have struggled it, keep winning, but that life is not so easy. So sometimes you have to weigh that. Then the other genetic disease is thalassemia, and it's also a blood disorder. So basically, it's carried the same way sickle cell is carried, which means some people are carriers, others are not. So if you're a carrier and someone is normal, that's okay. Yeah. And the last one is cystic fibrosis. unfortunately, we don't even treat cystic fibrosis in Uganda. We just maintain your life. So we empower the couple to know, are you willing to have a relationship with this child suffering to this extent, or to try other options, you know? So
before we go deeper, someone out there may not be knowing what thalassemia is and what cystic fibrosis is. So could you paint a picture for them what those conditions are like?
I'll actually start with the sickle cell anemia or sickle cell disease, because I am sorry, I presumed. Now, in sickle cell disease, the cells that carry your blood, we call that hemoglobin. It's shaped a certain way, normally. But if you have sickle cell disease, yours is sickle shaped, like curved like a C. So it means it doesn't carry enough oxygen. You can move around normal, but when you're in conditions when the oxygen is not very enough, then you struggle. So when you're dehydrated, when you have infections, when you're exhausted, actually also emotionally stressed. If you're sick and you're emotionally stressed, you get an attack. And in hospital, we call those crises.
Yeah.
So they can be normal, but any slight effect on the amount of oxygen available for them to take in, the thing that transports the oxygen in the blood is sort of restricted. It's not enough. Yeah. And in thalassemia, we have beta and alpha. So beta is the one that is more common. But in thalassemia, you have someone, still blood, and it's also part of the components of blood, because when we talk about hemoglobin, I'll not go very science, but hemoglobin has 4 chains. So in thalassemia, one of the chains is missing. Yeah, so it's still the same effect on how your blood is carried and all the other components that it's supposed to carry. Yeah, these ones, the chance for the child to survive if you're both carriers is actually very low. They have to be maintained, you know? Yeah. Then cystic fibrosis is, your body forms fibers. And, okay, it's all carried in the name, cystic fibrosis. And this affects your musculoskeletal system. You can't move. And the worst part is that these fibers can be deposited in your kidneys and you die. So it is a very hard disease to manage. And in Uganda, I don't know if anyone is managing it really. So when it's cystic fibrosis, we tend to give the couple an option of adopting, or maybe have, okay, we shall go into that, because there are actually very many options. We can actually use one of the partners to have a child. Yeah, there's some IVF things we also do. So that makes the testing more important because it opens your mind to what you're going to do next. Yes.
So also, are these tests available in Uganda?
Yes, actually available. And if both partners are carriers for the same condition, the chance of passing it to the children is so high. So when we find out, we tell you what to proceed. So they are very available in Uganda. I know very many diagnostic centers. And actually, your doctor, if you come to your doctor and say, I want to test for sickle cell, they direct you to where to find us. And not just us, it's so easy. And thalassemia and cystic fibrosis.
So what other tests can we do? Maybe in regards to blood compatibility, Rhesus factor and all. Yeah, let's talk about that.
So now you bring an important point about blood group compatibility, because we have different blood groups.
Yeah.
But now on that, I don't know if someone wondered why they write their blood group as O+. There's a patient who asked me, does that mean I'm positive for HIV or some other thing? So that plus you see, O negative is the Rhesus factor.
Yeah.
And some people are positive, others are negative. So it's one or the other. But now, why it's so important, if a mother is Rhesus negative and carries a pregnancy, even that pregnancy doesn't make it to term, even if it's a miscarriage, for a man who is Rhesus positive, the woman's body forms antibodies to the Rhesus gene. We call it Rhesus D. Anti-D, so they're called anti-D bodies. Those bodies, when the woman gets pregnant again and the baby is Rhesus negative, the pregnancy is terminated. Because these anti-D bodies that she formed will fight the other baby that they formed in the new baby. You get it? So, and sometimes the first pregnancy happens when you're still in the village, before you've seen the light. Now you're in a marriage where you want babies, but all the babies keep,
Yeah.
So it can get that bad. Yeah. But we are talking about testing. If you test in time, we actually have the anti-D hemoglobins we give you.
Okay.
You get that? So if we find out that you have this problem, we know how to fix it.
So it's not the end. So if I have a Rhesus, if I'm Rhesus negative
Yes.
and I have a Rhesus positive man, it's not the end. We have a solution.
Yes.
Okay.
The beauty is in you testing. And finding out in time. But also, it's important to know your partner's blood group. I don't know if any of our viewers knows their partner's blood group, because there are times when you're involved in an accident, right? And we need blood. And if you know the blood group, we don't waste time to test. Or you can actually transfuse them. Literally give them your blood. That sort of thing. It's so important to know, because I've been in health centers where the lab that is going to blood transfuse is in a referral. So you get an accident somewhere in Masindi or in Hoima, and they have to take you to Kampala for blood. It's crazy, But if someone that you love or someone is near you and they know their group and their blood is okay, we can use that.
Yeah.
Yeah.
Okay, that makes sense. Please do the Rhesus factor testing. It's very important. And then also, what other things can we test for? Maybe in line of infectious diseases like HIV.
Okay, before we get to infectious diseases, I would want us to importantly talk about fertility tests.
Okay.
Because
interesting.
This evaluates health for both partners, reproductive health. It's so easy for you to, in our Christian marriages, they say, no sex before marriage, right?
Yeah.
So this man pays all the dowry, does all the things you like. Then you marry him and you find out he can't produce. He can't, because there's something called sperm count. You literally need a certain amount of sperms to make a woman pregnant. So if a man has a low sperm count, or the sperms are deformed, the morphology, they do have two heads, or their tails are short or longer, those sperms can't make a woman pregnant. And culture has overemphasized the fact that it's always the woman who is barren, But it's not true. In the doctors, we know also, in the hospital, we also know men can carry infertility. So that's why it's important for a man to come and we look at the sperm count, we look at the morphology of their sperms, we look at the hormones, because hormones are so important, as we talked about last week. Hormones are so important in love making, but also in keeping the bond together. Yeah. So if a man is low on testosterone, their interest in sex will be kind of reduced. Their libido will be so reduced. And if it's in a woman, she may fail to have enough estrogen to maintain her pregnancies. Yeah. She may have less luteinizing hormone and all those hormones, prolactin, So these hormonal imbalances, which is a whole big point in healthcare, looks at how ready are you to suppress for them or to kind of increase on their need. Yeah. So, but we have ovarian reserve levels for women. You can also do an ultrasound of the uterus and ovaries, and hormonal tests like FSH and LH, follicle stimulating hormone and luteinizing hormone. And the tests for men include semen analysis, as I said. And this assesses the sperm count, the motility, can they really move, and also their morphology. And this part of fertility tests is so important because it assures you of what you're taking home. And early detection allows the couple to explore other options if needed. Yeah.
So you can know that, okay, we may not be able to get a child easily. We can do these interventions and everything. Okay, so hope you're learning like I'm learning. So we'll go to the infectious diseases. What infectious diseases can we test for before marriage?
Now, this is the part most people test.
Yeah.
Most people test for HIV, but HIV is not the only infectious disease you test for. And why these diseases? Because they're sexually transmitted. So things like syphilis, hepatitis B and C, HPV. Now, there's a problem with HPV. The problem is men don't suffer consequences with HPV, but women tend to suffer cervical cancer. It's a causative agent in cervical cancer. But men can carry the HPV from another woman to another woman without suffering the consequences of having that virus. So this means it's important for him to screen so that he doesn't get it to you. Because everyone tests HIV, Detamine and all the things you use. But these other diseases carry ground that if he has an HPV infection, we can actually treat it. Don't rush to met before doing these tests. Syphilis sometimes is easier to tell, so though it has a latent stage, there's a point in its cycle where there is no symptom. So he has syphilis, but he doesn't know. Yeah. HIV is a little bit well documented in this part of the world. Yeah. But keep testing. And also, when the results are not what you expected, it is not the end of the world. We're actually now lucky that we can have children from couples that are discordant. Discordant is a medical term to mean one is positive, the other is negative. And they have a child who is negative. So testing doesn't mean you stop. It means you choose the best option forward.
Forward, yeah?
Yes.
You talked about HPV, how it can cause cancer in women.
Yes.
So you said HPV can be treated in men. Can it be treated in women?
Yes, because the worrisome bit is it getting to cause cervical cancer. Yeah. But cancer has stages. So in the first stages, it's just actually we can do, we call it V&A. What's the full form of that? Acetic vision inspection under acetic acid. So literally we just screen, and if it's there, then we use ice to kind of take away the infection. You get that?
Yeah.
So it can also be treated in women. And even when it's starting to get to cancer, if it's in the real first stages, we can still treat it. So that makes screening the most important bit. Yeah. So it may be something you miss your whole life, but now you get the chance to pick it up. Yeah. The other tip about that is that cancers have a genetic component, which means if someone has cervical cancer, there is chance that they'll get breast cancer or prostate cancer if they're male. Now, which means screening for one cancer helps you unravel all those things. It may be the starting point of you being treated. Yeah.
Then what other tests can you do apart from the ones we have talked about?
I'll add chronic disease screening. And here we're looking at conditions like diabetes, conditions like high blood pressure, and thyroid disorders. And these chronic conditions need to be managed proactively, especially when planning for children. The one that I want to give a special mention is thyroid disease. Thyroid disease actually affects your sexuality. When you are when you have hyperthyroidism or hypothyroidism, your libido is decreased. And if you're a woman, your cycle may be messed up. You have very irregular cycles, then these things affect how you mate. So you're in a relationship, you don't know that you have a thyroid disease because when you're lucky, your thyroid also swells. So it's, actually I have a goiter. We call it a goiter. Yeah. But some people, it's just these other symptoms that you are not aware of. So when you come to us and we do TSH and also T4, T3, those are thyroid hormones, and find that the kind of levels are okay, then you can proceed with everything. Yeah. But when we find something amiss there, then we start treating these other things. Yeah. So thyroid disease is also one of the things you have to test for before you really start mating.
Okay.
The last test.
First,
okay,
hold on. So you talked about diabetes and hypertension. How is that important? Because it can't be spread to my partner. So what importance would it be for us to check if one has hypertension or diabetes?
Now, when you have diabetes and hypertension, because they tend to be together, it means you're going to be on chronic medication. Right? Now, also your lifestyle is supposed to be altered. Now, when you have those two things, you're not going to spread them to the partner, but they're going to affect your life. If you love someone so much and they have to, because we have what we call a diabetic diet, there are things they're not supposed to eat. So if you love them enough, you won't make them eat the things that kill them or that make their life hard. The simple tip is about salt. I usually remind my parents, if you're hypertensive, you have to reduce your salt intake. But funny enough, when you're hypertensive, you have a cravings for salt. I've seen people who go to a restaurant or a hotel and they first add salt to the food. Most cases, they're going to end up with hypertension, or they already have hypertension without knowing, because the symptoms are very subtle. So why it's important to test for these things? You hope this person heal. You hope them go through the phase. And unfortunately, we have now found out that there's also a genetic component in these diseases, which means if your father is diabetic and hypertensive, there are chances you also get those things if you don't alter your lifestyle in time. So now, this is empowering you. Like, okay, she's diabetic, it's not the end of the world, but this and this saves the children from getting similar problems.
Yeah.
Yes.
Okay. Are there any other tests we could do that we have left out?
The test we've left out is mental health assessment. In some countries, this is where you start. And you're not going to hear very many doctors tell you about this, but you have to understand the mad person you're taking home. There's that saying that everyone is mad, but you have to choose your mad person. So we have very many tests. And okay, to say this, I'm a therapist also. I treat people who suffer with coping with life. I've seen people who are depressed and healing through this. I've seen people who have anxiety issues. And I'm also trying to finish training for psychiatry itself. So you deal with real psychosis, schizophrenia and all that. But most cases, coping mechanisms and the emotional baggage we carry. So you're going into a relationship with someone who has been cheated on all their life. So their insecurities are up there. Small things mean big things. Like we talk about red flags. When the flag is somehow green, to them it's orange. If it's orange, it's already red because of what they have gone through. So we have tests that screen out for depression, some for anxiety, and how to cope because it's so much of behavior. And these things are not supposed to make you leave this person. You know, some people will have this fear of, if I find out that she has been depressed, because these things sometimes tend to relapse. You be well for a while, then it comes back. It doesn't mean you leave your partner, the love of your life. It means you help them through this challenge. Yeah, so, and mental health impacts the dynamics of the relationship deeply because addressing issues early helps create a stronger foundation. If you know I'm insecure and it's now creepy, maybe I have OCD, I have a compulsive disorder, you don't trigger me, you know? And it's so funny that if someone is mad, they tend to be obsessed with you. Have you watched You? There's a series called You.
You, yeah.
They give you that social psychopath who was so much in love with you, but if you start being what they don't like, they end up taking your life. So it's not that the mad person is going to kill you like they write it in the movies, but you can help them kill you with love.
Eh? Okay, so let me get this right. This mental health assessment, is it self-assessment? Like, do I just assess the partner myself, or I can actually go to hospital and tell a doctor I actually want to do a mental health assessment with my partner? Can they test for this depression? Can they test for it in the hospital?
Yes, clinical psychologists. There's something called PL9, PLG9. There are very many tests. There are things that you just give someone a question. Okay, most of these tests, and we have that challenge in mental health. Our tests are not like you draw blood and just find that. Yes, we are trying now to use CT scans, but that is too complex. What we do, we have questionnaires. We usually use questionnaires. So you give someone a questionnaire. What do they think about life? Do they feel lonely all the time? How do they cope? So the way they answer those questions makes you have an insight on what they're dealing with. And we use, we call it DSM-5, Diagnostic Statistical Manual, Volume 5. That's more of the American sort of thing. That one gives criteria for disease. Not everyone who is having low mood is depressed. There's a criteria. You have to have this sort of feeling for more than 2 weeks.
2 weeks,
and
yeah.
there are things associated, low appetite, your sleep. Or some people,
Lack of interest.
we are now having atypical depression where you're binge watching. You've shifted your phone and the only thing is look at your Netflix all the time and you're eating crazy. So when people see you, they can't see that you're actually depressed. So it's through the lens of someone who is trained to see the things that can see. So clinical psychologists have very many tests. Only I don't know how you're going to introduce it to your partner that I want us to see a psychologist.
Actually, let's go there. We have talked about all these tests, yeah? But I feel like sometimes the hardest part is telling your partner, let us go and do these tests. So how would you advise people out there, like what's the best way to approach your partner in order to request them to do these tests?
Okay, yeah. I totally get it. And it can feel like you're asking for a prenatal agreement for health. Like you want them to first sign somewhere. But the key is how you kind of frame this thing. And you can try something like, hey, I've been reading about how couples can prepare for marriage. And one thing that stood out was medical texting. I think it's a great way for us to learn more about our health and plan for the future together. What do you think? So you kind of bring it with the reason it's supposed to be done. But also show this person that you want them forever. That's why you want to get it right.
Okay.
I usually tell my patients this. Love is a funny thing. Funny thing in this way that you have to see someone's faults, like the things that are wrong with them. Then you also admit your own faults, the things that are wrong with you. And you say, okay, we are both going to stick together with our bad manners and make them work. It's not so much on your best behavior. So this testing and the need to do them is so much about you finding what you're going to work out. If the person has diabetes, how are we going to feed? Yes.
Yes. Then, in case, because most of these tests, they are more inclined to in preparation for our future children. Yeah. So if I don't want to have children with my partner, do I need to do these tests either way?
Yes, because these medical tests are not just about having children, and they are so much about ensuring that the relationship is the best, and they ensure you and your partner are healthy. That's the most important thing. They ensure that you guys are healthy. And infectious disease screening protects both of you. Before we even think about children and them getting sickle cell or even HIV, we are looking at the relationship itself. Yeah. So they are so much about the relationship being the best that both of you can have. Yeah. Maybe the other thing is, what is it a deal breaker if someone has a disease? I'll say no. You know, it's not that when you test and find what you didn't want, then it's off. It's not like that. When you test, you now know how you're going to proceed. Because with all the information, the medical knowledge that now we have in this world, most things can be solved. You make sure the partner is worth it to go through that mess and make it work. You know, so if a partner is a carrier for a genetic disorder, you can explore genetic counseling or even IVF, intravitreal fertilization, you know. You can also look at if an STI is seen, you can treat it. Hepatitis B is treatable, you know. If it's a mental health issue, you can help them cope. So all these things don't mean the relationship is over. It just means you know how you're going to do the rest part of your life.
Yeah. Then also, what is the timeline for these tests? When is it best to do them? Before marriage, 3 months before marriage, before entanglement? What is the best time to do the tests?
I would say before entanglement, because when you have intimacy with someone, it changes how you feel about them. More so to women, but also people who are agreeable. Those personality, with the way we describe personalities, but if you're agreeable, it means you tend to want to do good for the others. Then there are people who are narcissistic, and there are people who are, so they're still continuums, but the whole point is these tests can help you not to fall so deep if your intention is not to fall anyway. But the best time is when you're both ready. You can't say a year, a month, or what. It's when you're both ready. You make sure your partner is ready for them, you're ready for them, and it happens.
Okay.
Yeah, but best before marriage.
Marriage. So as we come to the end of the episode, we have talked about very many tests, and someone could be out wondering out there, how are these tests expensive? Are they cheap? And in the event that someone does not, because most people don't have medical insurance in Uganda, yeah, and they cover their medical bills with their cash. And so if someone is out there and they would want to do the tests, but they may not have cash to do all of them, are there some tests that are a must, that at least if you at least start with this as we find money to do the rest? Yeah.
Okay, that's a very good question, because you bring in the factor of cost. And cost can vary depending where you live and what you do. But basic tests like blood group, every health center can do. Basic tests like STI screening, I mean HIV, but also the results have to be channeled right. So the tests are not very expensive. They're actually affordable because we are trying to campaign for these things to be done. Yeah. But the other thing you asked was that which ones are a must? Like, what should you do before, if you can't afford the others? So I would list, the first one is it's STI screening, and there it's HIV and syphilis. Then I'll list blood group compatibility and Rhesus factor, because those ones affect the baby. Then I'll also list chronic disease. Because the diabetic, we just do random blood sugar or,
and
fast.
it's not expensive.
It's not expensive,
Yeah.
Hypertension is just actually blood pressure. Yeah. But the one I would advise my viewers to add to their list, because these other ones people are doing, is the part where you talk to a marriage counselor before it's marriage. It's like in part of your marriage preparations, you get time and talk to a doctor. You're like, we are going to be married and all this. How best can we proceed? That conversation may be 30 minutes, but saves you millions of money and time in the future. Because if it's a good doctor, a clinical psychologist, they will prepare you for the challenges that await you in your relationship. And that's sort of a test also. Yeah.
Okay, thank you so much for this episode. I'm sure people have learned about the tests that we're supposed to do before entanglement. So I'm requesting you to give closing remarks as we come to the end of the episode. What do you want to tell our viewers?
I've said most of the things. I want to remind my viewers that you're going for a journey that is worth it. So the beginning steps matter a lot. And that means go see a doctor. Kuchala a doctor before you go for the kuchala. And the doctor will do a few tests that make it easy for you to have the best love life.
Okay, thank you so much. We're happy to have you on the show. Thank you for educating us on the tests to do. For our viewers, hope you have learned the tests that we're supposed to do. So we do genetic testing, Rhesus factors, infections, even the chronic infections. I hope you've learned about thalassemia, cystic fibrosis, all that. Just put it into consideration before you go into entanglement. So that will be better. Our health, the health of our future children, the health of everyone at large. Yeah, thank you so much for watching this far. This is My Doctor Podcast. My name is Mwesigwa Joy. My Doctor, your health, anytime, anywhere.
My Doctor, your health, anytime, anywhere.